Hi, my name is Brian Sadowski. I am a board-certified general surgeon and colon and rectal surgeon here at AnMed. I joined the practice 3 years ago in the fall of 2019. So we wanted to put this together today because March is Colon and Rectal Cancer Awareness Month. Colon and rectal cancer is the number 3 cancer in both men and women. The good news is that colon cancer tends to grow very slowly, so it's considered almost completely preventable. Some people do have symptoms when they have colon cancer. Those symptoms might include bleeding, pain in the abdomen, changes in the bowels, either constipation or diarrhea, and other symptoms. Colon and rectal cancer is almost completely preventable because we have a good screening test. The most common test that we do is colonoscopy, which involves passing a long small camera up through the anus to look at the inside lining of the intestine. During that procedure, if we find any abnormalities, we can take biopsies and very frequently remove those abnormalities. So we have lots of time to be looking for the precancerous growths. Those are polyps. You may have heard people talk about polyps before. But if we find those polyps during a colonoscopy and we remove them, then they can never develop into cancer. So as long as we're watching and catching these precancerous growths, we can theoretically prevent cancer from developing in almost all people. Colon and rectal cancer does have a hereditary component, so if you have a family history of colon and rectal cancer, that puts you at an increased risk for developing it yourself, and you need to be generally screened more frequently and earlier than an average person. Colon and rectal cancer screening has changed relatively recently. For a long time, we recommended first screening exam to be done at age 50. In the recent past, we've seen a lot more colon and rectal cancer in our younger patients. So guidelines have just recently changed to start screening exams at age 45. So this means even people with absolutely no symptoms should have their first exam at age 45.